Hello, good afternoon, good morning, good evening, as the case may be. Welcome. My name is Sarah Dash, and I am the president and CEO of the Alliance for Health Policy. We are a nonpartisan nonprofit organization dedicated to helping policymakers and the public better understand health policy, the root of the nation's healthcare issues, and the trade-offs posed by various proposals for change. And we're thrilled today to be presenting today's webinar, Domestic Violence and Health, Understanding Root Causes and Policy Options. We're hosting this webinar in recognition of Domestic Violence Awareness Month. During Domestic Violence Awareness Month, victim advocates, allied professionals, survivors, their loved ones, and the surrounding community come together to mourn the lives lost to domestic violence, acknowledge the progress that has been made to end this epidemic, and connect with others working to create change. This work is critically important because no matter what we call it, domestic violence, intimate partner violence, gender-based violence, has long-lasting, far-reaching, and often devastating consequences for individuals, their families, and entire communities. For those of us fortunate enough to never have experienced this kind of violence, to live in peace and freedom from it, these challenges can be hard to imagine, but it is so important for us to understand the root causes, the connection to health and health policy, and what we can do. Now, for anyone listening or watching today or watching the recording who has experienced or is anyway feeling unsafe or knows somebody who is, help is available. And I want to point out the National Domestic Violence Hotline as one important source of support. That is www.thehotline.org. And you can also call 1-800-799-SAFE. That's 1-800-799-7233. So if we're going to be dropping that in the chat, if anyone has any immediate needs or concerns, that is your support source. Now, this webinar is going to be primarily focused on prevention of domestic violence from a public health perspective. I'm so grateful to Debbie Chang, who's here with me, and I'll be introducing in a moment for her leadership in this space. Let me do, before that, just a few quick logistical notes. You can follow the Alliance for Health Policy on LinkedIn to stay informed about upcoming events like this one, as well as on Facebook and YouTube. Today's panel is going to have a Q&A section at the end, and we would encourage you all to be active participants. So please feel free to drop a question in the chat at any time. There's a little speech bubble icon with a question mark on the right side of your web browser. You should be able to drop a chat in there anytime. And through the webinar, you can chat about any technical issues you may be experiencing, and someone will do our best to help. So with that, I want to just thank Debbie Chang, who is President and CEO of the Blue Shield of California Foundation, for her leadership in this space and for the generous support of the Blue Shield of California Foundation. Debbie has a remarkable biography in health and health policy, and you can read all about her online, but just tremendous years of experience in national and state and local health policy and prevention. But I think one of my favorite parts of Debbie's bio, which is we rediscovered recently, is that we both started off sort of as would-be engineers at MIT, except she was a real engineer in the chemical engineering department, and found a passion for public health and health policy and have taken it from there. So Debbie, let me now thank you again and turn it over to you for some opening remarks.
Well, thank you, Sarah, and thank you to your entire team at the Alliance for Health Policy. I also want to spend a moment just recognizing your tremendous leadership in the field of health policy. So thank you. So hello, everyone, and thank you for being here today. Today, you're taking an important step to be aware of domestic violence, which touches so many lives. Clearly, you're concerned. That said, you might be wondering, how does domestic violence directly relate to your work? I'll try to answer that. In California alone, 58% of adults are affected by domestic violence, either directly or through a close friend or relative. That's more than half of us on this call. Survivors are parents, children, students, employees. They're tenants, homeowners, homeless. They're immigrants, they're in the military, and disproportionately, they're people of color with low incomes. Like all of us, survivors use multiple systems throughout their lives: housing, healthcare, banking, the courts, employment, social services. Many of you work with survivors and their families in these sectors, whether you realize it or not. Domestic violence is everywhere, but it's also healable and preventable, and we all have a role to play in ending it. That domestic violence is more pervasive than we realize means that we, all of us here today, have more opportunity for impact as well. At Blue Shield of California Foundation, we believe the way to prevent domestic violence is to address its root causes: racism, gender inequity, economic inequity. I'm sure you care about these as well. Are we going to overcome those today? Maybe not. But our terrific panelists today are going to help us see across the many interconnected systems where domestic violence comes into play and where we can have an impact. Take housing, for example. When you talk to women experiencing homelessness, many of them will tell you that domestic violence drove them to it. So when we want to end domestic violence, we have to take into account domestic violence is a major cause of homelessness. And if we want to prevent domestic violence, survivors need safe, long-term places to live. The good news is we can develop policies that address these types of interconnected issues. In California, some of our grantees helped to craft a new law that intends to break down the silos between housing and domestic violence sectors. For the first time, the local agencies that prevent homelessness must include the unique needs of domestic violence survivors in their plans. And that's just one example. If you're working on social determinants of health, such as income, housing, and education, you're addressing the social drivers of domestic violence. If you're focused on child health and adverse childhood experiences, you're addressing childhood trauma and helping families heal, preventing domestic violence for future generations. The question I would ask you each to think about throughout this webinar is this: how can my organization and the work that we do, how does it already address domestic violence, and what more can I do, what more can my organization do? If we all leave with one concrete idea to put into action, we'll be one step further in building a future without violence. Thank you so much. Let me turn it back to you, Sarah.
Wow, thank you so much, Debbie. That was amazing. And just thank you for pointing out from a systemic perspective, and really, I think from your perspective as a systems person, how we can prevent it, and for the words of hope that this is healable, preventable, and for your early call to action. So with that, it is my absolute pleasure today to introduce today's moderator, Arlene Vassell. Hello, Arlene. So excited to have you here. Arlene is the founding director of Turrell Institute for Social Change. She is a sought-after speaker, trainer, facilitator, and thought leader, and she has dedicated her entire career to ending and preventing gender-based violence, disrupting systems and structures of inequalities and oppression, promoting leadership advancement of people of color, and developing equity-centered, trauma-informed, culturally relevant programming. Her work and commitment to dismantling inequitable systems and supporting survivors of gender-based violence have been highlighted in numerous publications and articles. She served on boards and panels and committees and received many recognitions and awards for her unwavering advocacy work. So, Arlene, it's just a pleasure to have you here moderating today's conversation, and I will turn it over to you.
Thank you, Sarah. Thank you so much. And thank you and Debbie for your opening remarks. And I want to ask everyone, right, as you listen to these amazing presenters today, think about your one thing. What is the one thing that you can take away from this webinar? This is going to be amazing. You're in for a treat. I am delighted to be here, and I am going to introduce today's esteemed, amazing panelists. First, I'd like to introduce L.Y. Marlowe. She is the founder of Save and Promise, a national domestic violence prevention organization inspired by 5 generations of mothers and daughters in her family that suffered and survived more than 75 years of domestic violence, including her granddaughter, a little girl named Promise. She is also the principal of the Harvard Learning Lab and Innovative Domestic Violence Research and Development Initiative at the Harvard T.H. Chan School of Public Health, an award-winning author and a sought-after advocate, lecturer, and influencer for domestic violence prevention. Next, you will hear from Bridget McCaw. Bridget is a national healthcare leader in family violence prevention, providing clinical training, conducting research, and contributing to policy development with a focus on the healthcare response to family violence. She was medical director of the nationally recognized Kaiser Permanente Family Violence Prevention Program from 2001 to 2019. She led the implementation of a comprehensive approach for improving screening, identification, and services from intimate partner violence. Then next, we'll hear from Dr. Juan Carlos Arian. Juan Carlos is an internationally recognized activist, public speaker, trainer, and facilitator, and published author. Since 1991, he has worked to engage men across various cultures to become better fathers, intimate partners, and allies to end domestic violence and achieve gender equity. He presently works as program director at Futures Without Violence. Previously, he served as director of the National Latina Network at Casa de Esperanza and as a sexual assault prevention specialist at Harvard University. And then finally, we'll hear from Lynn Rosenthal. Lynn Rosenthal is the HHS Director of Sexual and Gender-Based Violence at the United States Department of Health and Human Services, where she leads the department's work to implement the National Plan to End Gender-Based Violence. We're really excited about the plan and related initiatives. In 2021, Lynn was appointed by Secretary Austin to chair the Independent Review Commission on Sexual Harassment and Assault in the United States military. Wow, 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 wow. Like I mentioned before, you are in for an amazing treat with these esteemed presenters that will share basically, like we had mentioned before, root causes, policy options, how you can respond individually in your community as part of society, and create thriving communities for all. We'll now move into a poll question before turning it over to our first speaker, LY. And our poll question, is domestic violence preventable? Let's start the conversation there. What do you believe? Is domestic violence preventable? What are your thoughts? Please select one of the following, yes or no. Sonia, I'm not seeing the responses. Are you seeing the responses?
Yes, they're coming in, and I'm about to close it soon. Yeah.
Okay, great. All right, if you can share the responses, that would be great. I actually can't see them.
So we have 92% who said yes and 8% who said no.
Awesome. So for the 8%, I am hoping at the end of your time with us today, we will convince you that domestic violence is preventable and we all have a part to play. I will now pass it over to LY, who's our first speaker.
Thank you, Arlene, and thank you to everyone who's in attendance today for being here. I want to start by sharing that I come from a family of 5 generations of mothers and daughters that suffered and survived more than 75 years of domestic violence. I'm not, Amaya, I'm not being able to move the slide, so if you can make sure that I have control. Technology is always ahead of us. Let's see. Okay, there we go. Let me see. Yes, I have control now. Thank you. My grandmother, my mother, myself, and my daughter. But it would be the story of my daughter's little girl named Promise, when she lay on the bed next to my daughter at 6 months old, as my daughter was strangled and nearly killed for the second time by Promise's father. The story that would inspire me to walk away from a 20+ year corporate career to launch Saving Promise, a national domestic violence prevention organization. I remember years ago when Jim Mercy at the CDC presented this slide at a conference. And for the first time ever, and I mean for the first time ever, after generations of abuse in my family, I understood that domestic violence was a serious public health crisis of mass proportion. The burden and the trauma that domestic violence has caused my family is tragic. My grandmother experienced, alongside her 8 children, physical, mental, emotional, acute trauma at the hands of my grandfather. He even once forced their 3-year-old son to eat a dead rat. And all of his sons, 3 of them out of the 8 children, grew up to be abusive to their wives. My mother also experienced acute trauma at the hands of my father. Once he even beat her so badly that he burst both her lungs. I experienced severe physical, emotional trauma and maternal health at the hands of my boyfriend. He even once kicked me in my 8-month pregnant belly, and I would not come to know if my daughter was alive until I heard her scream in the delivery room. My daughter experienced strangulation, head injuries, severe trauma, and maternal health issues. And Promise was born into this generational curse. She experienced pre and post mental, emotional, and physical trauma. Years later, after I launched Saving Promise, I would be diagnosed in the last 7 years with long-term health issues, terminal health issues that impacted every part of my body that was now due to the stress of trying to save Promise. And my mother would eventually, 40 years later, after my father beat her and burst both her lungs, would die from terminal cancer because her lungs were still very fragile and never heal. And let's not forget about the men in my family. My grandfather suffered from mental illness, substance abuse, and emotional and acute trauma. It was actually his mother that abused him as a young child. And my father suffered from mental illness, substance abuse, and narcissistics. My daughter's father suffered from mental illness, substance abuse, trauma, violence, and poverty. And my daughter's boyfriend, to this day, still suffers from mental illness, substance abuse, and violence. You know, we can't not look at this We cannot look at this and say, that is LY's story. That is LY's family. That is her issue. This is not a community issue. This is not my family issue. This is a public health crisis. I wanted to share this story about my family so you can see the impact that domestic violence has on the health. You know, during the pandemic, the United Nations Office on Drug and Alcohol released a report that said, on average, every 11 minutes, a victim is abused. Every 11 minutes, a victim is abused. So what are some of these risk factors when we think about even that report that the United Nations released? What are some of the risk factors that we have to consider about what's happening in my family and what that report tells us? What it tells us is that on a community level, there's increased levels of severe violence across the lifespan. There's anticipated increases in intersections from mental health, suicide, homicide, poverty, and drug and alcohol domestic homelessness, like Debbie talked about. There's increases in injuries, mental health, non-communicable and communicable diseases. There's astronomical increases of healthcare costs. And there's also anticipated increases in annual costs around domestic violence and related costs like the cost of law enforcement and the cost of homelessness and the cost of treating mental illness that is estimated to be trillions globally. And there's an increase in all the other intersections that it touches, from social services, law enforcement, and other intersections and trauma-related factors. And guess who is paying for it? Guess who is paying for it? Every one of us is, whether or not we have experienced it personally. Intimate partner violence is a public health crisis ready to erupt. Let me say that again. Intimate partner violence is a public health crisis ready to erupt. I shared that the United Nations Office on Drugs and Crime released a report that said every 11 minutes, a woman or girl is killed by an intimate partner or family member. Imagine that, every 11 minutes. That means somewhere in our world today, in this very moment, a woman or girl is being tragically killed. And that doesn't discount that this is not a woman's or girl issue. This is not a community issue. Again, this is a public health crisis. And what if in the same 11 minutes, we can all do something about it? What if there's a way to educate every individual, every family, every community, every sector, survivors and abusers? We can't continue to fix just one side of the coin. We also have to address the abusers because they are hurting too. And what if we can educate them not only about intimate partner violence, but what healthy looks like? We have to change the dialogue. We got to talk about teaching people what is healthy and what does healthy look like. That is why Saving Promise recently launched the Only 11 Minutes campaign, a campaign that is poised to educate 11 essential sectors. And I'm talking the public and private industries, workplaces, healthcare providers, schools, law enforcement, youth and young adults, and the grassroots community about intimate partner violence and what healthy looks like. And get this, in only 11 minutes. Imagine if everyone attending this webinar today were to commit only 11 minutes of your time to get educated. I invite you to consider that. I'm going to ask my colleagues here today to drop a link in the chat to learn about only 11 minutes. And I invite you all to take that call to action and to click that link and to consider not only taking action, but passing it on. Because this issue has to be one where we all take action. In closing, recently I started experiencing sleepless nights because after 16 years, I've been at this for 16 years. Promise is now 16 years old. And I've been at trying to save Promise for 16 years. And I'm talking the holistic Promise, not just my brown sweet baby, the promise for us all. And I started to question, what if this doesn't work? Who am I to mobilize a call to action? Then I did something I always do whenever I'm experiencing a sleepless night. I turned on one of my devices to watch a boring movie. And I kid you not, in my duress and distress, this book popped up on my screen out of nowhere. The book is not only a #1 bestseller and has been made into a movie, but the subtle art turned out to be a bold challenge and an urgent call to action for people to stop giving a fuck about the things that don't matter and instead focus on the calamities that are taking place in our world today. Folk, domestic violence is a calamity. Let me say that again. Domestic violence is a calamity, a serious public health crisis that is killing people. And we gotta stop giving a fuck about what's not working and get to the root of this thing. Because if we do not do something about it right now, and I'm talking about 5 generations, so I mean right now, we're all going to continue to perpetuate the conditions that Mark Manson describes in his next book, a book about hope. I want to now turn it over to my colleague, Dr. Bridget McCall.
Well, thank you, Hawaii. I think you couldn't have made a more compelling case for why we need to be here today and why we need to act and act now. Next slide. I am truly honored to be part of this panel, next slide, and bring a focus on the crucial role of healthcare. And there are 3 aspects that I'd like to highlight. And first of all, in contrast to many other institutions, most everyone accesses medical care, starting at birth and at multiple times across their life. And there are so many opportunities in medical settings to identify intimate partner violence, to offer a caring intervention, to connect patients to resources that can lead to safety and healing, and most importantly, provide education and prevention. Secondly, because IPV has such significant medical and mental health impact, you saw the slide from Jim Mercy and LY's family. It is in our lane as healthcare providers and for policymakers thinking about healthcare opportunities. And then third, healthcare interventions for IPV make a difference. Women who are asked about intimate partner violence and talk with their provider are 4 times more likely to take steps to increase their safety. And this can break the cycle of violence that LY described. Next slide. This illustrates the broad medical impact of intimate partner violence. It's not just the injuries and mental health sequelae that we typically think of. And since this is a policy crowd, I want to highlight 2 things. Pregnancy. IPV is a significant contributor to a critically important national issue, maternal mortality and morbidity. It is associated with increased obstetric complications, peripartum depression and anxiety, substance misuse, and death due to homicide and suicide. And IPV increases the risk for many chronic conditions listed here, which are a major contributor to the soaring healthcare costs and impact individuals' well-being. Once again, IPV interventions that are initiated in the healthcare setting can positively impact both of these. Next slide. Here are some key points that are supported by the past 2 decades of research. We now know that psychological abuse, even in the absence of physical harm, has devastating and long-lasting health effects. Taking a moment to just reflect again on what LY told us. We now also understand more about how IPV exposure leads to short and long-term health consequences, and that mechanism is acute and chronic activation of the stress response. And we know that IPV frequently co-occurs with other social needs, behavioral health conditions, and other forms of trauma, and this must inform our policies and our interventions. Next slide, please. I want to pause and recognize the additional impact of other kinds of trauma that are root causes of IPV and health disparities. If these are not addressed, we will not make significant progress on IPV, which is why it requires all of us working together in the sectors we represent to really come together and make change. Next slide. So, policy really matters. In my world, the U.S. Preventive Services Task Force recommendation and the inclusion of IPV screening and counseling as part of the Women's Preventive Services under the Affordable Care Act were and remain important drivers for healthcare organizations improving their response to intimate partner violence. And policies related to Medicaid coverage and services like home visitation have a huge impact on patients, often those who are at high risk for IPV. We are seeing the benefits of policies that have been put in place. Next slide. But a meaningful healthcare response is about more than simply training clinicians or developing screening tools. It requires systems thinking. And the power of this approach comes from making use of the entire healthcare system and having all of the pieces connected, which is one of the main messages I want to present here, that if we really want to make a change and prevent intimate partner violence, it requires systems thinking. The power of the approach comes from making use of our entire institutions and our world and having all of those pieces connected. Next slide. This shows what it means in a healthcare system. And notice the orange section on the right. Community advocacy linkages is a part of the healthcare system response that is absolutely vital. Next slide. The good news is that there are now examples of US healthcare organizations using system model approaches that have implemented, spread, and are sustaining IPV services. For instance, the Veterans Health Administration. The Catalyst Project, which is a multi-state, multi-site initiative funded by a collaboration of federal partners, including DHHS and HRSA, that emphasize active partnerships between health centers and local DV programs. And Kaiser Permanente, where I had the privilege to champion this work. Next slide. However, a meaningful and effective healthcare approach has to be based in a framework of trauma and resilience-informed care. And that means shifting from the old approach, the old traditional medical pathology approach, which is what's wrong with you? We need to shift to what happened to you. Next slide. And that needs to be paired with a whole person approach that includes strengths, protective factors, and builds on the human capacity for neuroresilience and neuroplasticity, and holds as the North Star, healing is always possible. So our policies need to take into account and address the root causes that fuel and contribute to intimate partner violence. Our policies need to engage the health sector in meaningful progress to ensure that it is actually a place of intervention, connection, and resources, and IPV prevention. Our policies need to include attention specifically to maternal mortality, mental health, and chronic conditions that are associated with IPV. We need to look to successful healthcare organizations, which are exemplars. And finally, our policies need to use the principles of trauma and resilience-informed care as a foundation. So I'll stop here and pass to my colleague, Juan Carlos Arian. Thank you very much.
Well, thank you so much. Wow, it's been already such an incredible presentation. I'd like to start by greeting everyone, and my thanks to the Alliance for Health Policy and Blue Shield of California Foundation for the opportunity to come to you and talk a little bit about the work that we have been doing at Futures Without Violence, which is an international nonprofit based here in the US. Next slide, please. So my colleagues address in powerful ways the root causes of domestic violence, which is part of the theme of this webinar. And the truth is that this is a very complex issue. There's not a single cause for domestic violence. If there was one, maybe we would have solved the problem already. But I do want to lift what the great thinker Bell Hooks, and I keep on going back to her writings as I get older, she calls patriarchal masculinity. And other people use terms like unhealthy masculinity or toxic masculinity, which I don't particularly like. I know a lot of people, especially men, are turned off by this. But this idea of patriarchal masculinity, a masculinity based on domination and power over others, is what is at the center of domestic violence, in my opinion. And by the way, Bell Hooks says that patriarchy has no gender. So there might be a little bit of a contradiction there, right, to lift up masculinity. But the truth is that it's about power and abuse of power. When we're talking about a traditional definition of domestic violence, which is not only about slaps and pushes, but it's about a pattern of coercive control that one person has over other. That's when this is lifted. And the truth is that I have seen in my career cases where people of all genders, certainly women and people who identify in any way in the spectrum, where they have used power over others when they can. So it's very important to mention that this is not exclusively for people that identify as men. However, because of socialization, what I would refer as how boys learn to be men, it happens much more with people who identify as men as boys. So this is learned behavior by and large, and in some way this is the good news, that because this is learned behavior, it could be unlearned or changed. And I'm so grateful that LY, as part of your story, you also lifted up the struggles of men and boys in your family. Certainly, it's something I have seen in my family too, and the complications that things like mental illness, substance abuse, and trauma can bring into this problem. I think it's important to emphasize, and I'm sure you agree with this, that these are not the causes. These are not causes of domestic violence, but I often like to talk about that this is gasoline that is added to this fire of patriarchal masculinity, because not everybody who has trauma or mental illness or substance abuse has also a co-occurrence of domestic violence, and particularly if we divide this by gender, right? So it's the combination of this ideology of domination and supremacy that overlapping with some of these other elements. We know that a lot of people who cause harm have been survivors of trauma themselves. So when those things combine is when we get to that crisis that LY was talking about. And going back to the second bullet here, I want to emphasize that it's so important that we connect all types of violence, as Dr. McCall. I'm glad you list their intersectionality, because these things don't happen in isolation, right? And some of the same causes to domestic violence or sexual assault, teen dating violence, stalking, and so on, also expand to other kinds of violence. And I saw in your slide, Dr. McCall, that you even mentioned climate change and war. And I agree with you. All of those things are connected, certainly community violence, right? So when we expand our definition of what this patriarchal mode of masculinity, how it manifests, we can see that that everybody's affected by it, right? So my last bullet is that this kind of violence oppresses women and people of all genders, but also hurts men, not only because we are victims of violence, certainly as children, certainly of community violence, and certainly of war and climate change and so on, but also to be in that what some people call the men box of socialization, to be restrained by this patriarchal traditional masculinity has an effect on men too. And in fact, it hugely overlaps with the health and mental health systems. We know that men live shorter lives than women. We cannot make a direct connection to this, but this might be a factor. Suicidality is 10 times, right, among men and women, and it has becoming an enormous crisis in this country. And substance abuse use and reckless behavior, driving, and so on. All of those things are connected. So I like to bring this holistic view of this problem, because I think that will help us when we are trying to engage people who identify as men in this problem. So the next slide actually talks a little bit about some of the strategies that I and some of my colleagues have used for preventing and also for intervention, because I don't think there's a solid line between primary prevention and secondary prevention in these issues. So I think it's important to, again, be holistic in that way. But going back to what other speakers have said, everyone can play a role here. And everyone can not only teach, but demonstrate healthy behaviors, as LY. I love the title of your project, the healthy behaviors and healthy masculinity. To have a counter story of that patriarchal traditional masculinity that still are passed on to many boys in our society. We can be, in addition to positive role models, what some people call upstanders, active bystanders that can intervene when we see this kind of patriarchal masculinity in place, especially violence. This is very important, creating safe spaces for men and boys to talk. I always like to emphasize this, because I think if you weren't socialized as a boy, as I was, it's hard to understand that there are very few spaces in our society where men and boys can talk about real issues. Usually men get together and we talk about sports, we talk about cars, we talk about whatever else, right? But there's such few spaces where we can be real with each other. It's so important to create that safety. Actually, it's interesting because Dr. McCall just sent me an article that I think it came out yesterday about a new study in the VA system where mental health counselors were screening for IPV victimization and perpetration, and almost half of the subjects, 80%, were men, and almost half of them actually admitted to both to perpetration and victimization of IPV. So for me, it's like we have to create spaces where people can talk about that. And if we do, believe me, you know, I've done this for more than 30 years. And when you get a group of men talking about these issues, or young men, they just won't stop talking about it. It's such an important part. We have to include this idea of healthy masculinity to address not only violence, but the mental and physical health of men. And what I was saying before, that this patriarchal masculinity is detrimental to our mental and physical health, as well as to everybody around us, right? And we have to include a cultural lens to do this, and recognize that every culture has values that support this healthy masculinity, and values that actually support unhealthy or patriarchal masculinity. They might look different in different cultures, but every culture has that from within. It doesn't have to come from without. And parenthood can be a powerful motivator for change too. So my last slide has to do with some policy recommendations that my organization has been working for the last few years. We believe strongly that we have to expand programs that teach boys and young men about healthy masculinities. And one example is our flagship program, Coaching Boys into Men, which has been It's an evidence program which has been implemented in high schools, middle schools, and colleges, and in professional sports. There are other programs. This is not the only one, but we need to put efforts and money into this kind of approach. We have to address men and boys' mental health from a gender and racial justice perspective, because particularly young men of color are really struggling right now. There was a recent study that came out about men and boys in the US, and it was flabbergasting. 44% of 2,000 plus subjects in the study said that they had contemplated suicide in the last 2 weeks. 44%. And again, all of this is connected, because there was a strong connection with that traditional masculinity and believing in gender inequality. We have to invest in interventions for men and young men who already cause harm. And let me tell you, this is one of the most under-resourced fields that there is. Abusive partners intervention, restorative justice, helplines for people who cause harm, particularly young men. There's a dearth of programs and interventions and money going to this. So that's a very, very important point. And finally, we have to include domestic violence prevention and support initiatives directed at men, like community violence, making that connection, right? Right now, there's a lot of federal money going into community violence. There's a lot of federal money going into responsible fatherhood. We have to make those connections with domestic violence. And as I said before, everybody, every institution can play a role in this. And now I'm going to pass it on to my colleague, Lynn Rosenthal. Thank you very much.
Hi, everybody. I'm very happy to be here with you all today. And you couldn't have asked for a better group of people in these three speakers. And my topic here is the U.S. National Action Plan to End Gender-Based Violence. And I think you will see all of these important topics reflected as a part of this plan. So I'm looking forward to the conversation. So why a national plan to end gender-based violence? We are unique among some of our peers in not having developed these plans among some of our peer countries. And that's these plans are considered a UN Women best practice in how countries can move forward in addressing gender-based violence. We in the US have had an important framing for our work through the Violence Against Women Act and the Family Violence Prevention Services Act. So we have had a roadmap to move forward. But what the National Action Plan has created, or the National Plan has created for us, is a whole of government approach. The plan was brought about by an executive order that was signed by President Biden in March of 2021. This executive order created the Gender Policy Council within the White House, and it also charged that policy council with developing a national plan to end gender-based violence. So that's what brings us here today. Let's look at the next slide. This is our important vision for the plan, and I just love this in the face of some of the data we heard and what we heard from LY's story. So a very difficult picture that she presented that happens in an untold number of families. But it's our hope through federal policy, local and state efforts that we can achieve this aspirational vision, which is that the United States will be a place where all people live free from gender-based violence. And if you note in the smaller print here, that this vision applies to everybody. And it was very important for us here at HHS to ensure that gender identity, sex characteristics, sexual orientation, race, ethnicity, religion, age, disability, and all of the potential ways that people have been marginalized, that all of that is included in a vision that applies to everyone. We can take a look at the next slide. So, and I should say that the national, just stepping back for a minute, the national plan was developed through consultation with more than 2,000 stakeholders and 25 listening sessions. And there were key themes that emerged from those listening sessions. And you now see those key themes reflected in the guiding principles for the plan. So this work that you see in the guiding principles for the US National Plan to End Gender-Based Violence really came from all of the stakeholders that participated. One, that we center the voices of survivors, that survivors are the experts at their own experience, that if there's any place that we need people with lived experience in the lead, it's here. And I think you heard that from LY's story. Her contribution has been her family's story. And it's also been beyond that to her policy recommendations and her call to action, centering the voices of survivors. The plan also represents an expansion of our work to address gender-based violence beyond a criminal legal focus to focus on public health, public safety, and a life course lens. So this is about a population health approach that includes safety and well-being, and that addresses people's experiences with violence throughout the lifetime. We also recognize that gender-based violence is a form of gender discrimination. We heard a great discussion about that with LY and with Juan Carlos about how this comes to be and who's most affected. That patriarchal model sort of sets the stage for the kind of violence that disproportionately affects women and girls, but also has an effect on men and boys, and has an effect on non-binary individuals. And also we see an LGBTQ plus relationship. So patriarchy sets the model. Other forms of relationships are affected, but certainly women and girls are disproportionately affected. And that's what makes us recognize gender-based violence as a form of gender discrimination. This is a conversation that happens around the world almost more than it happens here in the US context. And this national plan brings that here to our attention. That it promotes federal leadership and coordination across sectors. So a whole of government approach means everyone from the Department of Commerce, the Department of Education, Department of Justice, HHS, and many other federal agencies, Department of Treasury, others that somehow their work affects the way that families may be experiencing violence and the way that others may be experiencing violence. So it promotes federal leadership in setting this tone. However, the plan is really meant to be a blueprint for everyone to use. So if you're a local official, if you're a mayor, city commissioner, there's something in the plan for you to think about and apply it in your own context. If you're a state public health official, the plan lays out a blueprint for you to think about how do you pull together state agencies using the model of the federal interagency coordination. So there's something for each sector in this plan, that it takes an intersectional approach, that people experiencing violence have multiple identities, right? Ethnicity, sexual orientation, gender identity, geography, that all of those factors influence how somebody experiences violence, and most importantly, how they can get help for violence. And so it's intersectional. We don't look at violence out of context of a person, their family, their community, their place in society, and that we're grounding this plan in evidence-based practice and research. So, but we also make space within that for innovation, and I'll talk about that in just a minute. So, but we know something now. You know, we have 2 decades of research. It's not, we don't invest as much as we should as a country, but we do have evidence-based practice. We do have evidence-informed practice, and increasingly research that involves people with lived experience. So we should be grounding our work in what we already know, even as we innovate for the future. We can no longer say that we don't know what works to prevent violence. We do know. It's a matter of political will, investment in strategies that work, with space for innovation to always be learning more. And finally, that we embrace a human rights-based approach to ending gender-based violence. So these are the guiding principles, and we'll take a look at the next slide, which shows us the pillars that the plan rests upon. So these are the 7 areas of work that, again, we've convened the federal government around, but that really belong to everybody. Primary prevention of gender-based violence, including social norms change. This is an area where CDC has really led efforts to identify risk and protective factors. We heard about that from our speakers. So that focus is a part of the national plan to end gender-based violence. Second, support, healing, safety, and well-being. This is really about trauma-informed practices infused throughout everything that we do, but also ensuring that trauma-informed practices are equitable and as accessible. So here you see our guiding principle of intersectionality. Are we really understanding trauma-informed principles from a culturally relevant and responsive place? So that's very much a part of this bucket, which focuses on survivor support, well-being, and trauma-informed practices. Third, economic security and housing stability. We all know that domestic violence is one of the leading causes of homelessness for families, for women, and for children. We know that housing instability is affecting everybody in communities today, and that survivors of violence carry a double burden when they're unstably housed. And we also know that domestic violence, gender-based violence, has an effect on survivors' ability to work, to earn income, to move forward in their lives. And we know that workplaces can do a great deal to provide help and support for survivors who are experiencing violence, to create those healthy and trauma-informed environments that we've been talking about. So that's a pillar in the plan, and we're already seeing some great movement in this area from the Department of Labor. Online safety is the 4th pillar in the plan, and this includes the non-consensual distribution of intimate images. We know that the online world is the real world. We increasingly know that. And so all of our efforts to think about gender-based violence, domestic violence, sexual assault, other forms of gender-based violence, that we can online always has to be central to responses that we create. And so that's here as a pillar. We're already seeing strong work from the NTIA and others who are connecting up sort of digital equity, broadband access, and online safety. So that's very exciting work that the White House has been engaged in through the White House Task Force to end online harassment and abuse. Legal and justice are still a part of this response. They're just not the only response. And in this pillar, we see recommendations for restorative approaches to the legal and justice systems. And the Justice Department is really leading in this effort. Emergency preparedness and crisis response. We couldn't have had a harder lesson about this than the pandemic. which showed us how vulnerable families and individuals are affected by a crisis of that nature. A meta-analysis informs us that domestic violence increased probably about 10% around the US, more some places than others during the pandemic. We know, and there's been some great writing in this area about the kind of isolation that domestic violence survivors experienced. Also, though, I have to say, as sort of a side note, that we also saw strength-based approaches. And I was working at a center in Columbus, Ohio, that had a domestic violence program as a part of a larger family advocacy center. And we thought in that time of the pandemic that the survivors we were working with would have difficulty accessing our services. And what we found is they were ahead of us in figuring out how to use technology to get the help and support that they needed. So the pandemic taught us a lot about how survivors are affected. It also showed us some strength-based approaches. Also within this pillar, we see climate change related disasters and how families and gender-based violence survivors will be affected in this way. And we here at HHS have an office on climate change that has helped inform some of this work in the national plan. And then finally, we know from the presentations we've heard today how critical research and data are to helping to move forward this work. And so what we haven't had in the US really, although we've had strong efforts at NIH and NIJ and the Office of Violence Against Women, and certainly at CDC with the National Intimate Partner Sexual Violence Survey, but what we haven't had is a coordinated research agenda that we can see could move these pillars forward. So look for that in the national plan. And then let's just take a look at the next slide. On the next slide, what we see here, and I just really wanted to include this, in pillar one, in prevention, the national plan charges us with developing health strategies that can be part of preventing gender-based violence. And so I really wanted to highlight these for all of you as health workers or health policy advocates to think about. And these are objectives right from the plan. And I have to say this work you see here is in some ways in its very beginning stage. It's part of our implementation of the national plan. So to apply health-based strategies to prevent gender-based violence, comprehensive and behavioral health support for people who are using violence. And Juan Carlos spoke about the effects on perpetrator, people who are using violence, on people who may be perpetrating violence, and what their experiences have been of trauma, what their own behavioral health and health outcomes might be as a result of that. And we haven't had this focus really within the federal government. I would say maybe our small effort at the Justice Department on sex offender treatment, but we really have not focused on, as a federal government, the needs of people who are using violence against family members. So the plan calls us to do that. We also, and this is a very comprehensive objective, to promote workplace gender-based violence and equity policies for healthcare systems, measures to create safe, trauma-informed healthcare facilities. So here we're speaking to patients who are receiving care in health facilities, but also to providers who work in those systems. So creating I think Dr. McCall talked about, so what could a healthcare system look like in this way? And we're called to that here. And here we do see the preventative healthcare service that is a reimbursable service in the Affordable Care Act to promote routine screening and brief counseling for intimate partner violence by healthcare providers. And also to really focus on what's working, what do we know, what should we be doing more of, what should we be doing less of, and taking Dr. McCall's point that really screening is one small part of this overall approach to what the healthcare response could be. So we're really called to that in this strategy. And then and expanding our thinking around gender-based violence beyond intimate partner violence, which is what that strategy, what those provisions in the ACA refer to a broader thinking about how are healthcare systems working on sexual assault, sexual violence, stalking, and trafficking, and related forms of gender-based violence. And then to ensure that healthcare systems are working to address the social determinants of health that we talked about. So what I was excited about on this panel is I was glad to be being last because I felt that our national plan touched on every key aspect that we heard from our speakers. And I'll just end by, again, urging you all to think about, you can find it, I'm sorry, I didn't include a link here, but you can find it. It's a White House National Plan to End Gender-Based Violence, and it was released by the White House in May of this year. It's very comprehensive. It also has an at-a-glance document that travels with it that tells you the goals and the objectives in a short form. You, as a local, state official or advocate, could pick up the plan and read the section, the pillars that are most relevant to the work you're doing. I also want to encourage state and local officials, government officials, to connect with health policy advocates and also state domestic violence and sexual assault coalitions to help inform your work. But we really urge you to think about this plan not just as a whole of government approach, but a whole of society approach. And I'll end with that.
All right. Thank you so much, Lynn. And thank you to all of the amazing speakers. Lynn, I must say the plan is a gift to the field. It really reflects our voices. So we're really super excited about it. Thank you for your leadership in getting the word out and getting the plan completed. So before we move on to our Q&A, I just want to ask everyone to just take a moment to hold LY's story. LY, thank you so much for sharing your story. And I just wanted to give everyone a moment to just hold it, right? To just hold that story. Yeah, generations. Thank you so much for sharing. Let's just hold that. Yeah. There's 143 people on, I think. I can see the numbers. Yeah, if you want to know why we're here, why this was put together, LY's story basically says it all, right? And some of the things that came from the speakers that I want to quickly reflect on, this is a public health crisis ready to erupt. Thank you for that. Serving perpetrators of violence, individuals who cause harm is important. We heard healing. We heard whole person approach. We heard root causes, right? Domination and power. We heard the shift, right? As advocates, as service providers, shifting from what is wrong with you, right, to what happened to you. And that's just plain language for what is meant by trauma-informed advocacy, right? It's shifting, right? It's not what's wrong with you, it's what happened to you. And Tonya Kane is an advocate that I've heard talk about that a lot. Holistic approaches, intersectional approach, prevention on a continuum. We all can play a role, right? So oftentimes it feels massive, right? It feels massive. It feels like, what can I do? You can look at prevention on a continuum, and the presenters will I'll give them an opportunity shortly to share just one thing. If you don't take anything else away, what is the one thing that each presenter would like you to take away, would like you to do? Again, because we all have a role to play. Another key thing as we talk about intersectionality that Juan Carlos talked about is using culture as a motivator for change. And I'll just stop there. Give the presenters an opportunity. What is the one thing? I know we probably want more because we're advocates, right? But if you had one thing that you would want to ask our participants, one thing they can implement, one key takeaway, what would that be? And LY, I'll start with you.
Thank you, Arlene. Thank you so much. Thank you for acknowledging my family. The one thing that I would say is we can all get educated. You know, I talked about the Only 11 Minutes campaign, and I'm not trying to just promote a campaign. I'm just trying to create and break the silence and create a way for people to take a little bit of their time, 11 minutes, and learn about not only what is intimate partner violence, but what does healthy look like? Imagine that. Imagine if we took that time to learn about what does healthy look like, and that person pass it on to, we actually have a campaign called Pass It On, because this takes a village. So be part of that village and learn about, and I'll ask my colleagues at the Alliance to drop the link in the chat for people to take 11 minutes to get educated.
Thank you. 11 minutes. Bridget, what is your key takeaway, your one thing?
Well, I think I have more than one, but the one that I really want to say right now is asking all of the attendees to read the National Action Plan and find 3 action items that are relevant to your work, share it with your colleagues, and make a plan to start acting on them this month. And I'm going to pick up the phone and call my NIH colleagues. I was so struck by what Lynn said about the importance of the research agenda and how that is lifted up in the national plan. I'm going to call them and find out what's happening at the Office of Women's Health Research Agenda and how to get the focus on incorporating IPV. So that's my action item, and I encourage everyone who's listening to pick 3 out of the National Health Plan.
I totally support that. My action plan is like color coded. I have all kinds of markers and and stickies all over. Juan Carlos, what is your one thing?
Yes, again, hard to choose one thing, but I think a very strong theme in this webinar has been that we all can make a difference and that every system has a role to play here. And I like to share something. We often talk about the statistics and the research that the majority of men, and I will use this word on purpose, of men who use violence grew up in abusive households. And this, as I said before, was learned behavior. One thing that we don't talk about so much is that there's research that shows that the majority of boys who grow up in abusive households do not go on to be abusive, right? And that is such an important and hopeful statistic. And going back to Lynn's research agenda or the plans, it's like, for me, it's like a key question. Why? Right? And I do think we have answers to that. And the CDC has put it forward, the presence of a loving adult, even one in that boy's life that learned violence otherwise, can make all the difference. So we can be that person, right? And we can be that institution. So that is my one piece.
Oh, thank you for dismantling that myth in less than 30 seconds. We appreciate you. Lynn, what is your one thing or one key takeaway that you want everyone to focus on?
Well, even though I presented on this grand plan, I want my one thing to be a little closer to home. And that is that we know that friends and family are really key to people, to breaking the isolation that domestic violence survivors feel. And so I want everybody to know what the resources are in their community, to know the national hotline number, and to know the number of their local domestic violence provider and their perhaps culturally specific domestic violence provider. So now that people who've sat on this webinar that may not work in this field, I will assure you that now somebody in your life will disclose to you. It's just how it works. You have this program, you'll see this around you, or someone will confide in you. And so you want to be prepared to respond in a very helpful and non-judgmental and supportive way. And what you don't want to do is the tendency that all of us in health and social services tend to do, which is step in and try to fix it. What you want to be able to do is listen and be supportive and be there for someone who may be struggling and be able to provide information that could be helpful. So that's my one thing. Friends and family, equip yourself.
Awesome. Thank you, Lynn. I'm so glad that you brought that in, because oftentimes we think about prevention and we think about intervention and we think about prevention, and it's like or, right? So I'm glad you brought it an and. We need to do both, right? We need to really enhance our responses, learn, just be good citizens and focus on our family and friends and bystander intervention and also prevention. That is the only way. It's not an or, it's an and. All right, so questions coming up. There was a resource question. So Lynn, since you talked about resources, let's go to that question. Are there any resources, and this is for anyone who wants to jump in, Are there any resources you would recommend, books, articles, audio that define healthy masculinity? Juan Carlos, maybe you want to start and then anybody can chime in. Any resources?
Well, there's probably if you do a Google search, you will find some things there. There's great organizations that do good work around this. A Call to Men is one example. The work of Dr. Jackson Katz is another example. I think he wrote a book called the Macho Paradox. I don't love the title, but it's a good book. And if you go actually to the Futures Without Violence, we do have sections on that, and our program, again, Coaching Boys into Men, goes deep into not only what it is, but how we can pass it on to boys and young men. And there's like Tony Porter from A Call to Men has a great TED Talk about this. So those are the ones that come to mind right now.
All right, anybody else want to chime in?
I would say that from a federal perspective, to the Administration for Children and Families, Family Violence Prevention Services Office has a great website with a lot of resource, as does the Office on Violence Against Women at the Department of Justice. So there's no shortage of great information from the advocacy level to the government level. The information's really out there for you.
Okay, and feel free to reach out to the host of this event. I'm sure they can connect with all the panelists to get some additional information as needed. All right, so anybody again can take this one. What can college student leaders do to prevent IPV on campus and advocate for change?
You know, I'd like to add to this question. One thing that I want to acknowledge is that one of the highest demographics that experience intimate partner violence, dating violence, sexual violence is young people. Mm-hmm. And we know that young people are not only great motivators, but movement makers and shakers. Mm-hmm. It's not a question of what can, it's a question of what must we do to make sure that they are engaged. Okay. You know, I had a conversation with Promise not long ago, and I was blown away by how forward-thinking she is. I believe Lynn talked about online safety. We got to meet them where they are. They are online. They're not doing this old-fashioned shit no more, right? They're not like reading. You know, they will read a national plan. You put it out there on Instagram, right? We got to create a framework and a platform and a space for them. They have to lead with this. So we need to not only challenge ourselves to engage that demographic, but how can they lead the charge? And not only at the university level and post-education level, but I'm talking at the middle school level to start with. We got to get them when they're younger so that they could continue to carry it generations forward.
Yes.
I would say on campus, there's been quite a lot of well-developed work on college campuses, sort of starting with a focus on sexual assault, but really expanding to dating violence. So It's on Us is a campus program that it's a national program, but the individual chapters are very locally driven. So somebody could see if there's an It's on Us chapter on their campus or start one, and then you can focus it in the area that you want to focus on. We also at HHS have 2 initiatives that have not yet come to fruition, but are in progress, and that is a congressionally mandated task force with the Department of Education and the Department of Justice that looks at sexual violence in secondary and post-secondary education, and the second is a mandated work group on teen dating violence. So we're in progress on those initiatives, and we'll be reaching out to people to provide input into them. But there's been so much work on college campuses that I think if you start with It's On Us and go from there, In Rape on Campus is another great organization that's doing work for survivors specific to the campus environment. So there's lots out there. It's a great question. And as LY said, it's an important place to start.
Yes.
And I just wanted to add, sorry, Arlene, that the Office on Violence Against Women has a campus program too. And that includes working with young men. And I put on the chat, or I asked to share a website on that particular work. Sorry to interrupt.
Oh, no, that's fine. Resources, more resources for our toolboxes. And I also want to offer the Red Flag Campaign is another campaign that was developed by a state coalition for college campuses. All right, anything else? Okay, we have a couple more questions. Are there any new pieces of legislation that were recently introduced in Congress that are working to address these root causes that you all are discussing? Ooh, great question.
Well, the Violence Against Women Act was reauthorized last year in 2022, and it included some of this expanded focus that we've been talking about. I will tell you from my perch now, I'm not tracking the Hill so much, but I take the question, and I'm certainly willing to do that and connect with the person who's asked. And I don't know, Juan Carlos, you have a very active policy shop, so that would be another place to connect with Futures Without Violence policy shop.
Well, if I can mention a couple that are in the pipeline, of course, there's the Violence Against Women Act and the Family Violence Prevention Act, but the Race from Trauma Act and the Community Mental Wellness and Resilience Act. We are advocating for those. Again, this is about making the connections between all kinds of violence and not only domestic violence.
All right. Okay, another one for a college student. What can I do as a college student? And thank you for engaging with us. Thank you for being here. What can I do as a college student to address these issues on campus, besides what I can do as an individual like you all mentioned? I like to help organize a safe space for men at school to open up in ways Dr. Ariane was describing. Juan Carlos, I'll start with you. Great question. Thank you.
Great question. So it was shared actually in the chat, a website that we created on engaging men that has tons of resources or ideas, and I'm not sure what the gender of the asker is, but everybody can play a role. Certainly, engaging men is not only about men engaging men, right? And I think to open those spaces of conversation are so important in campuses, right? And to be holistic in that way. I worked at a major university, I think it was mentioned, Harvard, in sexual assault prevention. It was fascinating, as I said before, when that space was created, and this is not only like a men-only space, but that space where you let young men and young women and people from all genders, like, okay, you can ask any question about this, and let's talk about it, and let's really dissect it and try to figure it out. It's such a powerful thing to do. So I would encourage the person who asked the question that to work with the administration of the university. Many universities have initiatives now, or are part of maybe the Women's Center or the other places where these spaces can be created. And the more people start having these conversations, the more change will happen in the long run. So that's my short answer.
Yes.
I'd like to add to that, which is that often there's an opportunity in the campus health center to suggest that as a space for these kinds of conversations. And part of the benefit of doing that is that these conversations often move into other areas, such as mental health or behavioral health issues, has to do with substance use, has to do with well-being. sometimes connected to health in various ways. So having a place where there's an investment in creating an opportunity for people to talk with each other and resources nearby can be a way of implementing something during the time that you're in school that can be sustained past your time by other students that come up and can be embraced by the campus health center.
Great answer, Bridget. Anybody else want to chime in? I do want to add, like, when we talk about safe spaces, to also talk about brave spaces, right? So safe and brave spaces, big difference. So I want to add that. All right, I think we have one more question. Question for Juan Carlos, LY, or Lynn. Since speakers mentioned cultural norms, do you know about effective practices or movement work to influence cultural and societal norms to support the efforts being presented today? The cultural norms change may not look like DV prevention, but rather may look like gender equity, Me Too, or maybe racial and economic justice. Wonderful question. Would you like me to repeat?
That's
No?
got the Juan Carlos's, that's his answer right there. Let's go.
All right.
Yeah. I think that the key is to understand that those norms look different in different cultures, right? And lifting that, because if you're trying to influence a culture from a different culture, especially if the dominant culture, that is not going to work.
Right. Ooh.
Well, and CDC is very focused on this in the Delta program, the primary prevention program, which also includes a focus on health equity and culturally responsive approaches to primary prevention. But I think starting with Futures Without Violence is really a great place for somebody to go for this.
I agree. All right. Well, amazing questions. Thank you all so much for your questions and your engagement. Presenters, thank you for your very thorough responses. I would encourage anyone that has additional questions or need additional resources to reach out to the organizers, and I'm pretty sure they'll connect with the presenters to get the information out to everyone. I'll now turn it over to Allison.
Thank you so much, Arlene, LY, Bridget, Juan Carlos, and Lynn for joining us today and for all the critical work that you do to help prevent and end domestic violence. My name is Allison Jones. I'm the Director of Program Strategy and Management here at the Alliance, and I just want to thank all of you who took the time to be with us here today. We hope you found this discussion informative and will be able to take what you learned and use it in your work moving forward. We want to hear from you. So at the end of all of our events, we do ask you to take a few minutes to complete a brief evaluation survey. You're going to receive this in email later today. And I'd be remiss if I didn't mention a few other upcoming events that we have here at the Alliance. We host educational webinars and in-person events throughout the year. You can follow our LinkedIn or visit our website to sign up and receive updates about our upcoming events. One of these is our 2023 Signature Series Congressional Briefing, just a few weeks on November 1st, which will explore the role of the U.S. healthcare workforce in achieving a person-centered health system. This event is free and open to the public, and you can register on Eventbrite to receive your ticket to attend. We are also excited to be hosting our upcoming annual dinner on November 15th and encourage you to reach out if you're interested in learning more about our sponsorship opportunities. As a reminder, a recording of this webinar and the additional materials will be available on the Alliance website. This concludes today's webinar, Domestic Violence and Health, Understanding Root Causes and Policy Options. Thank you all for joining us.